Hey friends, welcome back to the channel and another video. My name is Dr. Caroline, a practicing board-certified family medicine physician, and in this channel we talk a lot about maximizing productivity and scaling our income as primary care physicians. And I've done quite a few videos on these topics, and so if you're completely new to this channel, then I definitely invite you to check out some of my other videos from before. There are several strategies that I believe are critical in scaling one's income, and we have an entire program on this where we teach primary care physicians these key critical strategies to reach their income goals by maximizing productivity or RVUs without overworking, becoming overwhelmed, or risk falling into burnout. And these are strategies that I personally implemented in my work when I was struggling and going through burnout and trying to figure out how to do it on my own. If there was a program like this back then to walk me through the entire process, to guide me step by step in trying to figure out how to create a more sustainable workflow and how to maximize my productivity and income without overworking or risk falling into burnout again, I would have definitely signed up for it. And other providers who have gone through this program and have implemented these strategies have seen great success. So if you're struggling to find a more sustainable workflow or struggling to break through your income ceiling and are going through a stressful time trying to figure out how to do it on your own, then I definitely invite you to apply to our RVU consulting program so that we can help you through this process. The link will be below in the description box. Now, as for this video today, like I said, I've discussed a few of these key critical strategies in my previous videos, but if I were asked, Dr. Caroline, what are the 3 top strategies that I can implement today to maximize my productivity and my income, then the ones that we'll discuss in these videos are going to be those top ones. But again, if you want to delve into the details and learn how to actually implement these strategies so that they benefit you the most, then check out the link below to apply to our program. So the first top strategy is you must maintain an adequate patient volume. And now when I say volume, I don't automatically mean high volume, but rather an adequate volume. You have to see enough patients in order to bill for enough services, which eventually down the line converts into revenue. You cannot think that you'll see 10 patients a day and earn a $600,000 income. Maybe there might be some situations like that out there, but I personally have not heard of any. Now, what volume is adequate will vary from one physician to another depending on several different factors. A couple of the main factors are going to be, number one, of course, you have to abide by the requirements of your job. So whether you're working full-time or part-time, you have to meet the patient volume requirements of your job. The second main factor is going to be what kind of workflow are you looking for and how much more income are you trying to generate. And this is the main thing that we target in our program. So a provider that's trying to maintain a salary of $200,000 probably doesn't need to see as many patients as a provider that is trying to earn $600,000. So knowing your income goal will guide you to realize how many more or less patients you need to see. And once you establish this volume, then you have to maintain it. So day to day, the number of patients that you see will likely vary because of no-shows, cancellations, etc. But you should have an idea on average how many patients you see in a week or a month and ensure that you're hitting your target. The second top strategy is master billing and coding. As a physician, you do have to understand enough about billing and coding in order to bill and code appropriately to not leave any money on the table. You don't need to be at the level of a billing and coding specialist, but you do need to understand enough. There is absolutely no point in doing all that hard work that you do in taking great care of your patients to only then undervalue your work when it comes time for billing. You have to be able to summarize your work into the appropriate codes and bill appropriately in order to generate the revenue that those visits are worth. So do yourself a favor and put in a little bit of extra effort to better understand billing and coding. The third top strategy is learn to provide profitable services. One of the top mindsets that you have to adopt is service first. When you're seeing your patients, always ask yourself, how can I be more of service to my patients? And this does not necessarily mean that you're spending heaps amount of additional time with each patient, because unfortunately, but realistically, we don't have that kind of time. We only have about 15 to 30 minutes typically, depending on the type of visit, to spend with each patient because there's another one waiting right after that to be seen. But in the time that you do have with each patient, see what all you can assist them with during that time. So always put the patient first. Take great care of your patients and everything else will fall into place, including maximizing revenue. Now, time management and efficiency are going to be key in order to maximize productivity and revenue. So before you can implement any strategy at all, you have to establish good time management skills and learn to be efficient. All right, friends, I hope this video was interesting to you. If it was and you'd like to see more content like this, then consider subscribing, because I do post a video like this every single week, doing my best to help primary care physicians maximize productivity and scale their income without overworking or risk falling into burnout. If you're ready to take charge and implement these key critical strategies and establish a more sustainable workflow and break through your income ceiling, then I want you to comment below, sign me up, and we'll send the link to our program directly to you. You can also check out this link in the description box. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.